And now I'm going to introduce Dr. Andrea Gross, who is the clinical fellow at the National Cancer Institute in the Pediatric Oncology branch. The lead investigator on the selumetinib study. She was very experienced with all these outcome measures. There's so many on that trial. So we look forward to hearing about the patient engagement part of that.
Thank you all so much. So excited to be here and really, really excited to talk about the work that I've gotten to do with REiNS and the patient representative training aspect of things. So I don't think I need to say this again because I feel like we've heard this maybe 400, 500, 600 times today, but I think we all agree that patient engagement is incredibly important. There's a lot of benefits. Again, these are all ones that have been mentioned before, even just during this session, about increasing the relevance of our clinical trials, meaningfulness of our trial endpoints, and the fact that as patients and caregivers, you guys really bring the experience and the unique perspective we need to design meaningful clinical trials. So again, I don't think we need to convince anyone here. This is a very busy slide, and really this is actually borrowed from a site called EUPADI, which is the European Patients Academy on Therapeutic Interventions. But really, this blue line across the middle of the slide is just showing kind of the beginnings to the ends of research, from research priorities through design, all the way out through dissemination once a new treatment has been approved. And oops, this thing is sensitive. The things I have starred here, I just really wanted to point out are opportunities that we feel specifically for REiNS in trial development, where patients and patient representatives can be incredibly, incredibly valued. So again, setting research priorities, designing the actual protocol, practical considerations, ethical considerations, all of these things are really important. But there are some barriers to that. There are some barriers to us all working together. And again, one of them is having patients interested in participating in the process. I don't think that's a big barrier. I think we have crossed that barrier and achieved it. We know you guys are all here today because you're interested and excited in participating, and we're so grateful for that. The second is getting researchers to be open to working with patient representatives. And as Pam said earlier, I think are all really excited, and this is something that has been a change in the last decade or so in the scientific community of making patients and patient representatives more partners rather than just the people who are participants in the experiments, more passive. So we want to make sure that you guys are active participants. So again, I think that's a barrier that we have already overcome and we're moving beyond. Education for researchers about the importance of patient engagement. That was a huge part of what was done at the December meeting with the REiNS group and continues to be something that we are emphasizing. So again, I don't think that's a huge barrier. So that leaves the last barrier here, which is education for patient representatives about protocol and study design methods. Because you guys are not all trained to be clinical researchers. You have day jobs, and that's as it should be. But in order to come into the world of clinical research, there's a basic terminology and understanding that we all need to be able to share in order to have conversations about trial design. So what are kind of the key components that we have been thinking about in our group when we've been meeting? So, and I'll mention who at the end of the talk, but the group of patient representatives and researchers that have been discussing what really needs to get covered in order for patients to be engaged in this work. Most of it is going to be the general background stuff. So what is a clinical trial? Many of you may know from participating in or having family members participating in, but actually going forward and designing a clinical trial involves a different set of skills and a different way of thinking about things. How are clinical trials designed? All the complicated terminology that we use without even thinking about it, and all the jargon that we use, really important that we're all speaking the same language. Of course, learning about what the ethics of clinical trial design, why do we do clinical trials in some ways? How is it ethical to do a placebo? When is it ethical? That kind of thing. It's a really interesting question. And again, as clinical researchers, it's something we think about, we receive training on, but we think it's important that as patient representatives, if you guys are going to be equal participants in the process, we want you educated on that same material. And then the basics of methodology. What are the different phases of clinical trials? Why do we do different types of clinical trials? Again, just to have a better sense so that we're all speaking the same language. The last part is more about NF and schwannomatosis specific information, which is not as, I think, going to be as much of a hurdle because most people are coming in with a lot of personal knowledge, but sometimes if we're talking about an area in which you don't have specific personal experience, it might be helpful to provide education along those lines. So this is what we've discussed and kind of have come up with as our proposal for our patient representative training paradigm, but this is a work in progress, so we are absolutely looking for feedback and input on this. This is completely open to change, and we absolutely would appreciate any thoughts that anyone here may have. Our overall thought is to have a three-pronged approach that combines online learning modules, in-person training sessions, and then a glossary or dictionary of terminology for patients and patient representatives. The online learning modules will likely be a combination of pre-made versus custom modules, and there will be some that we would ask all patient representatives to do. So what is a clinical trial would probably be something that we would want all REiNS patient representatives to do. But if you're on the neurocognitive outcomes, we might have you do a neurocognitive specific training. What are neurocognitive outcomes? Why do we look at them? We also would want to do a glossary, because again, a lot of the issue that we've come across in reading the papers and looking at the literature is that the terminology is not clear. So we've actually had some of our patient representatives go through the REiNS literature that's been published and have picked out all the words that really should be defined, and we're going to create a glossary so that when people are reading those articles, they become more approachable. And then lastly, but I think actually most importantly, along with the REiNS meetings, we're hoping to do in-person training sessions, so potentially discussion panels with experts, so that more of like a little mini school education about what a clinical trial is, clinical trial design, and one of the things we'll have to do as a group is come up with what topics will be relevant for those. So what are some of the ongoing challenges and ongoing that we're working with? Well, one is, what modules do we use? So we've been really excited. The Children's Tumor Foundation has some fantastic educational materials, and we have been looking at their educational materials on NF and also on patient engagement, and I think we'll be able to incorporate some of those into our project. In addition, there are other groups like EUPADI, the European Association I mentioned before, that has a lot of free information about, and whose whole goal is to get patients engaged in clinical trials and research. And then there's other programs like the CITY program, which is actually what we as researchers take to educate ourselves about the ethics and the background of research. We also, again, in terms of the in-person training sessions, we'll need to work on determining what topics and making sure that the topics themselves are relevant to all patient representatives. So I just want to give a huge thank you to everyone on the Patient Representative Education Subcommittee. We are small but mighty. And for those of you that are here today, so Dale, Barbara, Scott, and Klaus, and really all of you who have now volunteered. I know in the last few weeks we put out a call for people to give us feedback on some of these additional thoughts that we have, and so I've gotten a whole bunch of emails, and I'm looking forward to working with a lot more of you in the future. So thank you.